So, with that, I'd now like to turn things over to my colleague and the director of the Recompete Community of Practice, Jess Wilkinson. Jess is also from RTI International, and she will help frame today's discussion within the broader Recompete landscape.
Thanks, Marissa. Good afternoon, everybody, and welcome. Thanks to everyone for joining us today for this conversation. We're going to highlight the pilot project implemented by the Springfield Holyoke Recompete Coalition, funded through the U.S. Economic Development Administration's Recompete Pilot Program. Like Marissa said, I'm Jess Wilkinson, and I'm an economic development researcher at RTI International. I'm the lead for the Economic Development Administration supported Recompete Community Practice. So we've been tasked by the EDA to work with coalitions from across the country, like Springfield Holyoke Coalition, to connect them to each other and create opportunities for them to learn from each other. Um, Before we begin, I just want to take a moment to recognize just how significant this initiative is. The Recompete pilot program was a very competitive federal program designed to support regions facing persistent economic or workforce challenges. So only certain areas of the country were eligible to apply. Even though it was limited to those certain areas, 565 coalitions applied from across the country, from 49 states and 4 territories. All of these groups had really big ideas for reconnecting people to quality jobs. But of those 565 applicants, only 22 actually received the grant that Springfield Holyoke did. So it's a really big deal that this region has a leg up on many in the country already. Springfield Holyoke stood out for bringing forward an especially innovative and community-centered approach, and their proposal reflected a very strong understanding of those local barriers to employment, but also a willingness to think differently about economic development and workforce system and supporting services and how they can all work together. In our experience working with these communities across the country, this type of initiative is proving to be very promising. We're seeing growing recognition that economic opportunity is about a lot more than just job placement. It requires addressing broader systems and supports that bring people to participate in the workforce and so they can advance over time. So today's presentation is going to offer an opportunity to hear directly about how this pilot came together, what's been learned so far, and like Marissa said, talk about where this is going to go from here now that the foundation has been laid by this work and EDA support, and especially now that EDA support is starting to wind down. We're excited to have the Springfield Holyoke team with us and grateful for y'all's willingness to share your experiences. And with that, I'm going to pass it over to Larry Dixon, the Springfield Holyoke Recompete Project Director, and the team to get us going.
All right, good afternoon, everybody. Do people see my screen? Everybody hear me okay?
Yep.
Great. Well, hey, everybody, thanks so much for making time to be on this call and to hear a little bit about the work that we've been doing. We're going to share today a little bit about the Springfield Holyoke Recompete pilot work that we've been doing. And then, like Jess said, we want to start to explore other partnerships so we can grow this initiative to continue some of the regional transformation that many of us are working on. My hope, and I think all of our hope on the coalition, is that this isn't a one and done conversation, but the start of one. And so today, the way my presentation is going to go, we'll talk a little bit about the context and the problem in Springfield and Holyoke, how our initiative got going, the model and what we're learning, really sort of that larger recompete framework model, but also the pilot that we sort of drew from the framework to do, and then also start to have some discussions about partnership opportunities. So Springfield and Holyoke are gateway cities. And in Massachusetts, there are 26 gateway cities. And they're characterized by, they have an industrial past, there's high economic potential, they have diverse populations, and many of those populations also have multiple barriers. The median household income is below the state average as well. So Springfield and Holyoke together, the population here is almost 200,000 in the area that we're working. And in our region, healthcare is the leading employer in both communities. Bay State Health employs about 13,000 people in the region, most of them in Springfield. And then also Trinity Mercy Medical Center employs about 1,000 people. So the problem that we have is really twofold here in this region. And at the simplest level, we've got these two pieces that just don't fit together. People need jobs and employers need workers. In Springfield and Holyoke, we have about 24,000 unemployed and underemployed individuals who are between 25 and 54 years old. We also have a number of employers that need workers and can't retain the ones that they have. So this leads to inadequate growth and stagnation. And if we don't address this problem, we're going to continue these cycles of generational poverty with little economic growth here. And so to break this down a little bit, we have this problem because there's just these systemic breakdowns. And I think those of us that work here realize a lot of this. So as I said, those 24,000 residents, they have multiple challenges, whether it's barriers around getting housing, around getting childcare, transportation, English language skills, and many others. And they also get very overwhelmed in trying to seek out those assistances individually. At the same time, we have several training and social service programs going on here. But those services and supports tend to be fragmented and they operate in silos as well. So they're not integrated as they need to be. With our employers, we know that we need with our employer partners, what we know is, roughly they make on average 200 to 400 hires a month for frontline entry level positions. But the other thing is that those workers come with many challenges, and employers are not equipped to address those challenges. So that leads to this lack of retention and advancement opportunities for residents, where workers move on if they can't move up, and those that couldn't last drop out. So residents, we've been calling this the stack of instability, and residents are caught in the stack of instability. And so what that means is those residents have multiple challenges that make it hard to get a job and retain a job. And even the slightest of shocks can create instability and crisis. So those shocks, those challenges include bad debt, credit problems, housing insecurity, childcare challenges, food insecurity, transportation gaps, many others. And what we're hearing more now with some of the pilot participants that we're working with, other issues include substance abuse, behavioral health challenges, and domestic violence, which is coming up more and more now as with our participants. And so on the left shows some of our pilot baseline data demonstrating these multiple barriers. And that one shot can change everything with people on the margins. And when you're already balancing so much instability, one more thing can really be that straw that breaks the camel's back. So that's a little bit of the problem. And I want to just turn to the coalition and what Jess was talking about, sort of the EDA Recompete pilot project process. So back in the summer of 2023, the Economic Development Administration of the Department of Commerce released the Recompete Pilot Project RFP. Several partners in the area got together to start to discuss this, and we decided to pursue it. So from summer of 2023 to April of 2024, we pursued the Strategy Development Grant as well as the Recompete Plan process. And we were, as Jessica said, we were a Strategy Development Grant recipient, so we received that award. But we were also one of 20 finalists for the $20 to $50 million award. I think there were 6 of them made. Now, we didn't get that money, which is unfortunate. However, at the same time, having a $20 million opportunity in front of you really takes off some of the barriers and the blinders that you have of saying, oh, we could never do this. We don't have enough money. It's transformative. And so it really brought a lot of us together to start to think about, these are some of the things we've always talked about. How could we do them with this type of money, with this type of transformational money? And so it changed the tenor of the discussion. So we held dozens of meetings with over 100 entities and resident groups, including community-based organizations, residents, workforce development training partners, employers. I think we had up to 20 different employers at the table. We had service providers, municipal partners, we had funders, we had economic development and planning partners, and we also had some state partners at the table. So all of this to say, as we were discussing this, it really came to be that, there's a real recognition that complex challenges are going to require some real cross-sector solutions. And so it's really this space that provided us stakeholders to really envision how we could create an integrative system with residents that guides them so that they can become stabilized first, move into training, get the supports that they need, and then move into work so that not only that they get a job, but they can retain it and move up and become economically mobile. So all of you that are on this call that live in our region have heard this expression. We're rich in programs and poor in systems. So we heard that over and over. The other thing we heard that residents are really exhausted and they get lost in this whole system. Um, I broke down the different things that we heard into 5 different categories around silos and lack of coordination, employer misalignment, residents, and then lack of resident voice. And on that silos and lack of coordination, one thing that came up again and again is that we have siloed systems, siloed partners, and siloed sectors that, whether it's workforce development, training, and services, they're not integrated together. So there's a real opportunity there. That also led to this notion that we're really prioritizing outputs around those areas over outcomes around really getting people hired and retained and economically mobile. On the next hand, we had, this employer misalignment. So we know that job seekers have many challenges and employers just don't know how to address them. So that's a major problem. The other thing that we heard too was that there were some training programs that also provided some case management as people were being trained for jobs. But then when that person moved into a job, that case management ended. So in fact, some of the employers talked about really the importance for how can we get some sort of on-the-job case management. The next thing we heard too was around there with all these different multiple challenges and stressors, residents have different needs and they need to go to different partners, which takes a lot of time to try to get there. And when they do this, we don't really know if they're actually taking advantage of some of those different referrals. So people make referrals, but there's really no closed loop referral system to monitor if people are taking advantage of that and then moving along some sort of continuum. And then finally, and most importantly, I think, one of the key things that we heard over and over again was that residents who are really, the end users of this whole system, they're not involved in designing this complex and difficult to navigate system, which is one of the reasons why they're exhausted. So how could we find a way to do this, to actually sort of bring all these things together? And during that time, we had this discussion. And one of the things that kept coming up again and again was this concept of a Sherpa or a guide. And, we have a system that's very complicated. What a Sherpa does, it's someone that, they know the local terrain, they can help guide people through it, they can help carry the load. And in fact, they can help them reach their goal of getting to the top of the mountain, whether it's Everest or what have you. It's kind of the same situation here from the resident's perspective. There are many different places to go to get services, to figure out training, to figure out how to address that challenge, but they don't know where to go. So as we progress this thinking, we started to think of this person as a guardian angel. They know the complex landscape, they can guide people through it, they can help carry the load and help that person get the help that they need, but they can also step in and intervene when needed and basically look out for them. And so as we started to continue to design this idea, we envisioned that navigation and case management really sort of as guardian angel support. So from the get-go, these were some of the primary partners with us, and these are the primary partners with us today from 2.5 years later. And we're intentionally trying to take this ecosystem approach where our partners are working across workforce, education and training, housing, support services, employment, and data. All of these partners have a history of partnering with at least one other partner here. So we haven't partnered with everyone. So that's what we're trying to do is build on these small partnerships that we all have to sort of build, to knit together a larger system that we're working on. So this coalition of partner brings together several different things which are important for the work that we're doing. You know, this cross-sector composition that I mentioned, which includes employers, the public sector, and community organizations. Um, we're also building on these existing relationships, which is helping to build trust and the connective tissue between them, between different programs. There's also a real ability and desire to coordinate across silos and to start to really move from those outputs to outcomes. So we're building on all of this, but I think one of the important things too to note about this coalition is that we have employers at the table. And that's really critical for us because having them at the table, they're really like they're the pot of gold at the end of the rainbow, so to speak. Everybody's trying to get a job, so they're on their journey, but they might get the training, they might get the supports, but then they don't get that job. So having employers at the table is really that final link in the chain so that we can ensure that we can get these individuals hired and retained and ultimately pursue their goals. So from a model perspective, the model we came up with for this whole recompete strategy was really focused on integration and a continuous system, a lot like what I've talked about, where we have, you know, social service supports and wraparound supports and navigation and case management. We have workforce and training and skill development. We have employers at the table providing jobs, and we have different resident voices and lived experience all working together to address this problem. And I think in some ways we started to achieve some of that. And some of the key features of this model is really this notion of portable case management and navigation that goes with the resident. One of the things, like I indicated earlier, that we heard loud and clear is that sometimes there's case management, but it's attached to a single program. Once that person gets out of that program and they try to move to the next step in the, you know, to become economically mobile or get a job, they don't have that. Or they might get a different case management program now. So what we decided was if we could figure out a way to do portable case management that doesn't stick with the program, but sticks with that resident and follows that resident from stabilization to training to employment to career growth and to economic mobility, that's what we wanted to do. So that's one of the key things we're really trying to build out, one of the features of the program. Like I mentioned too, we have employers at the table. They're active participants. We've developed MOUs with them. And in some cases, we have co-case management agreements with them and the supervisors that are overseeing some of these residents. So that means the supervisor and our case manager is talking together, understanding why maybe that participant didn't show up for work, some of the challenges they may be having, so we can start to backfill those gaps with them. And then the other key thing is this notion of the closed loop referrals. And that's through 413 Cares. And 413 Cares is an actively managed social care platform, and it connects individuals to different verified resources and partners, which enables service referrals, access, coordination, and tracking. So now we can refer people into these programs. We can see if they're taking advantage of it. We can coordinate with those other programs, and we can see what the impact of those programs are in those individuals. So the way the model works is roughly like this. So we align partners and integrate systems. So we use MOUs to outline roles, responsibilities, and expectations with those 9, 10 different partners that you saw earlier. So that helps us integrate supports, training, hiring, and some of the retention supports that we provide. Then the next step is really using residents are referred into the program through 413 Cares. And at that point, they're assessed by the case manager. They start to understand what the barriers are, develop goals and plans for them to actually pursue. From that point, then there's all this integrated case management, service support, and wraparound supports that goes along with it. And it's broken up into sort of these two different areas. The first is around economic stability programming. So things such as education programs, training programs, retention, pursuing economic mobility, all of those things that are going to help them economically grow. The other piece that we also provide or these barriers, these wraparound supports, which are critical. And then finally, sort of the feedback loop is we track and mitigate as needed. So as this process goes on, we're tracking and monitoring resident success and setbacks. And it's important for us to measure the setbacks as well, because as new challenges are identified, we're able to start to bring on and identify other strategic partner areas that we need to focus on. So for example, one of the things that wasn't really on our radar screen when we were initially thinking about this was domestic violence. And based on the work that we've been doing with our pilot participants so far, that's come up as a big area. So that's one of the things as we continue to grow that we want to start to bring in partners like that and really start to work towards how do we make some of these systemic changes there. So all of this work that we're doing, it fills a gap. It doesn't duplicate existing work. And I want to have you all think a little bit about imagine a construction site or a field, and you've got all kinds of blocks and bricks thrown everywhere. They're random and disparate. And now think of those bricks as some of these different programmatic assets, whether it's training assets or service assets that people might need. They're disparate, they're thrown everywhere. It's a little bit like the current system where people have to navigate to try to find these things because it's hard for them to go around. So some of those different bricks laying around might be housing bricks, the RAFT program. They might be the home-based program or other housing programs. They might be different food assistance programs, which was SNAP and food pantries or other local programs that we have. It could be different training programs, whether it's patient care technician training so people can get a credential or medical assistant training, ESOL training, or culinary training. It could be legal assistance to seal quarries. It could be legal assistance to seal evictions. So all of these things are out there. They're just scattered about. What we do is we arrange them together and provide the mortar and the leadership and the connectivity so that they're integrated into a foundational system for resident success. And I feel like that's really the big area that we really are trying to work on. So we're not duplicating anything. We're trying to leverage all these different pieces and connect them together. So we didn't get the $20 million. We didn't get the full recompete plan. Um, but as we were continuing our discussions with EDA, they encouraged us to try to start to pilot some of the key aspects of our strategy. And so that's what we ended up doing. It was never our first intention, and we only had, I think it was about 8 or 9 months to do that. And so what we decided to do was to take them up on that. And so we sort of formed it into 3 different cohorts. The first one we call this family prosperity cohort, which is really how do we identify people in the community who need to be stabilized so that then they can start to move into other areas around training to grow or into employment opportunities if they exist. The second cohort was really around workforce training. So we worked with Springfield Technical Community College and Holyoke Community College to identify 12 at-risk residents that are already enrolled so that we could start to provide them services and supports so that they can finish their credential and also hopefully move into work. And then the third piece was really around the employer cohort. So we identified 15 at-risk incumbent workers who are already at the different employers of Bay State Health, Mercy Medical Center, and Holyoke Health Center. And then we tried to, and then the model was we'd provide them all these different activities. And those activities were they were referred, we would use 413 cares to test that, to refer them in. They were then within 2 or 3 days, the case manager would assess them, identify different barriers that they have and challenges, work with them to come up with this family prosperity plan, which is essentially, it outlines their personal goals, their professional goals, and different areas that they need to work on to get there. It's a very tangible plan, so they're aware of this. They actually have it, and they can look at it and fall back on it. And then weekly touch points by the case manager to help them navigate systems, to help them access supports and services, to do collaborative problem solving with them, and to continue to track that and make sure that they're taking those different referrals that are given and following up on them. The other key things that happened was the supervisor coordination. And so the case manager would work very closely with the training supervisors of those individuals, as well as the employer supervisors of them, to understand where barriers might be and help to address them. And then finally, the career planning also did some benefit cliff planning with them and just tracking them over time and to make sure that they're following through on this work and that we can see what their progress is. And so the results were actually much better than we had anticipated that they would be. And so from the family prosperity cohort, we had 13 of 13 residents that had addressed their challenges and and became stabilized. Now, 8 of those 13 are employed, 2 of them are in training, another one seeking a job, and the other 2 are continuing on their plan to become stabilized. On the workforce training cohort, we had 11 of 12 residents complete their training programs and or 11 of 12 residents completed their credential programs, and 8 of them are employed now. On the employer cohort, 14 of 15 of the workers retained employment over 6 to 8 months. That's 93%. That's a 93% retention rate over 6 to 8 months, which is pretty transformational considering that for typical roles, it's a 40 to 60% retention rate over that same time period. So that was a major surprise, and it was a major indicator of success. And then our evaluation also shows that participants and employers alike attribute a lot of that success to the program and the work of the navigator and the case manager that we're working with to do this. So I wanted to just point those things out. And I think the other thing too, because of 413 Cares, and we're able to track some of this, and we can figure out what it takes for those 14 individuals in the employer cohort to reach that retention. And some of the data that we have is of those 14 that remained in the program and that are retained, 8 of them received raft assistance for housing. 2 of them received transportation assistance. 2 attended first-time home buyer programs and followed through on those. 3 had financial literacy training. 2 received ESOL training. And then a couple of others received assistance to pay for arrears, car insurance, and utilities. So you add all that together and you get 14 residents kept their jobs as opposed to just 7 to 8 that would have kept them if they didn't receive those services. Now, those services are not a lot of money. A lot of them are these existing programs out here that need to be leveraged. The real value, though, is that navigation and that case management that was given to them. And then the final point here that I have on the slide is pointing out the housing stability outcome that we had. So 5 employed residents went from homelessness or emergency shelter into stable housing, and 1 is actually pursuing home ownership now and in that process to get that going. I think that's really important to call out because we don't often think of employed people as homeless, but many of them are. And so just by helping them access these services, they can stay employed and retained. So what I want to do now is I'm going to pass this off to Jody Smith, the Senior Vice President of Housing Education Services at Wayfinders, and she's going to talk a little bit about how we help residents navigate across these different systems to be successful and how we're working to integrate these systems.
Thanks, Larry. Good afternoon, everybody. So this slide really highlights what it takes for a resident to succeed and why working across systems is so critical. So a lot of what I'm going to talk to you about really reinforces and stresses what Larry has been talking about. So for most residents, success isn't just about getting a job, right? It means navigating multiple systems at the same time. So typically people are on their own trying to figure that out, going through 5 different doors or more. And so each of those doors represents a different system. And I think that's where people get stuck, they get overwhelmed, and they sometimes give up in that process. So if you think about yourself, right, you think about yourself, if you had to navigate any of these systems that are on your screen on your own while you're working, maybe you're in a training program, you might struggle to manage that. You may not know where to start. And so that's what happens with our residents. I see this even here or in other social service organizations where we see employees coming in for support and help. Highly capable staff, right? That sometimes are doing the same work. There's a personal stressor, and it can be very overwhelming to try to navigate a complex system in which they're seeking help. So what Recompete does different is it takes those 5 doors that somebody's trying to navigate and it turns it into one. So through our navigator, our case manager, residents have a single point of entry. Somebody who's walking alongside them is helping them coordinate everything. Most of these resources that you see, they already exist, right? We're not creating new programs. What we're doing is building a system to be able to access them effectively and connect them in a way that works for residents. So in practice, what that looks like in housing, like Larry's talked about, we're helping residents access RAFT to stay housed, to move into new stable housing. Maybe it's to get the utilities back on or keep them on before they go off. In workforce and training, we're coordinating with providers, with employers, the supervisors so that we can support placement, but then also support retention. On the legal side, maybe it's a license suspension we're trying to help resolve. Quarry issues, eviction ceiling. There's an eviction record that is getting in the way of somebody being stably housed. Social services, we ensure access to benefits like SNAP, childcare when it's needed. Transportation could mean reinstating licenses. Maybe there's a fee that's getting in the way of them being able to get to work. Working with them and coordinating with them how they're going to get to work, and what can they do if something comes up along the way. And then financial capability, really supporting credit repair, debt management, really coaching them even on what is a budget and how to budget and really sticking through that. There's a lot of trauma with money, so that it's a difficult thing for folks to navigate. So every system here addresses a real barrier, but it's how they work together that really drives outcomes. So without that coordination, it's overwhelming, but with coordination, it can become more manageable. And that's really where success kicks in. So that's how we're seeing 93% retention. We're not just helping somebody get a job, we're really helping to stabilize everything that's around that job so then they can keep that. So that's why the navigator role is so essential. It really turns a system of silos into a more coordinated pathway to success. And also important, and I want to make sure I highlight it, is our Resident Leadership Council. Ensures that the system is shaped by people who are navigating it, that we're bringing that voice, we're bringing real lived experience into how we design and improve the work. And that's exactly, what makes this approach different. So I'm going to turn it back to you, Larry.
Great. Thanks, Jody. Appreciate that. So one of our key learnings is that creating stability for residents creates stable workforce and improves retention rates. And so Joanne Olson, the Director of Human Resources at Mercy Medical Center during the pilots, is going to provide an employee partner perspective on the project's impacts on retention and the value to employers.
Thank you, Larry. Good afternoon, everyone. I think, when we're talking about retention, we can see that great number right there on this slide, 93% retention of recompete participants in the workforce. And so what I'd like to talk a little bit about, I think that's a wonderful outcome, some of the lessons that we learned going through the process. And so this was a little bit out of scope for my work, but I learned a lot of things throughout this work. And most importantly, I started to look at myself in the role that I was playing as a champion, an internal champion, somebody who was in the building on a day-to-day basis championing this program. And my first order of business as the champion of the Recompete program was to find partners within the organization, supervisory partners who really valued the concept of the Recompete program. And most importantly, though, even beyond that, were supervisors who knew our workers and knew those who were had challengers and barriers to employment, continued employment. And so the outcome of that, partnering with the right supervisors, which I see as a very important role for the champion, is that we identified people that really wanted to participate in the program, 7 overall from Mercy Medical Center. And as indicated, we were able to retain those employees during the entire pilot program, which may not have been the case otherwise because we had very, very high turnover in both food and nutrition, where some of the employees came from, as well as central transport. So it was a very, very good partnership with the supervisors that were selected to assist in this program. And then secondly, the reception of the participation in the program internally was incredibly positive. I had, throughout the course of the pilot, I had employees that were seeking me out within Mercy saying, can I get into this? Can you help me get into this? And so that was just, anecdotal, of course, but spoke volumes in terms of how not only supervisors that participated or allowed or helped to identify employees to participate, but actual participants, they were spreading the word within Mercy about what a great program it was to participate in. And then thirdly, and not to make it the third and last, but the outcome, of course, was the retention that we experienced during that period of time, that 6 to 8 month period of time. And as I said, when I opened, it was just really so much better than what we had experienced for quite some time. Higher turnover rates within those 2 particular job classifications, but many, many other job classifications as well.
Great. Thanks, Joanne.
Sure.
Yeah, and I think, as we've grown with this and with other employers, we started to think about framing this a little bit more as an extension of the employee assistance program because it's providing so many supports for some of the things that these different workers need. Most of the 24,000 people we are targeting qualify for assistance, but they need support to access it, which is another real key learning of the project here. Caritza Ostalaza, who's the Recompete Navigator case manager, basically our guardian angel support provider, and she's an employment specialist of Wayfinders, is going to share a participant success story of how navigating across systems leads to resident success.
Good afternoon, everyone. I wanted to share a little bit about Recompete and why this program is so important. A lot of our individuals we work with want to succeed. They want stable housing, employment, education, and a better future for themselves and family. But in reality, navigating the systems can be overwhelming. What makes Recompete different is that we don't just hand participants a list of referrals and send them on their way. We walk alongside them through the process. One of my participants I work with entered the program while being homeless. Before she connected with me, she was already connected with a counselor at AISS to work on obtaining her GED and employment support. When she entered Recompete, one of our biggest priority was to get her secure emergency shelter for her. She was actually denied 3 times. And honestly, after multiple denials, many people would give up. But through the advocacy, persistence, and support from the community legal aid, helping appeal the denial, she was finally approved and placed into emergency shelter. Once we were able to stabilize the immediate crisis, we continued working on the bigger picture. Through home base, um, she moved into an apartment on December 31st, 2025, which gave her temporary stability while continuing to work towards her goal. At the same time, she stayed focused on her future. She enrolled in CNA training and successfully graduated March 17, 2026. Her long-term goal is to become a registered nurse, and she continues to move towards that path. As we continue working together, she was later offered a permanent affordable apartment at Springfield Meadows, and she is scheduled to move on the end of this month on the 31st. We also worked through legal barriers together. I accompanied her to court while she worked on sealing her eviction records because the process created a lot of anxiety for her. She's also currently working on sealing her quarry record, which impacts both housing and employment. And for me, her story really represents the recompete. What it recompete is about, and not just housing support or employment support alone. It's about helping participants navigate multiple barriers at once while having someone consistently walking beside them throughout the process. And I truly believe on this, on Recompete, and enjoy doing this work and enjoying these success stories and seeing my clients transform while I'm working with them. Um, Back to you, Larry. Thank you.
Thank you, Karitza. So these are just some of the findings that make us really super excited about this coalition and the potential of this work for for regional transformation. And for this systems change type of work to happen, we need to continue to build partnerships to do it. And that's why we'd love to find more ways to work with all of you all. So in the near term, these are some of the things we want to do. As I mentioned, we didn't receive the full $20 million of support, and our EDA funding ended in December. Since then, we've received a year of bridge funding. And what that bridge funding has helped us do, we're able to maintain these 40 participants, continuing to keep them retained, and also trying to build some other programs to move them up. We're also going to bring on an IT trainee cohort. So there's several things in the works, and I just wanted to share some of them with you of areas that we want to go. So we'd love to expand to more residents. We've heard from our trainee and employer partners that they could easily refer another 500 individuals to us so that we could start to work with them. So there's clearly a need here. We also realize there's a real need to do some more work around pilot career pathways. We've heard repeatedly from several of our participants that they're already working two jobs. If they're expected to do another training that's going to get them to another 25 cents an hour, it's not going to help them much. So what we want to try to figure out is how can we compress a few trainings so that we could get them to sort of jump from just making an additional 25 cents an hour to maybe a dollar or two more. So that we want to try to do more of that so we can really start to build some of that economic mobility. The other piece I mentioned too, this data dashboard, we really need to do a little bit more work. We've got this information now. We're able to pull it out, but we're not able to do it in real time. So we want to do some more work on that, as well as start to analyze the data that we have about what inputs seem to be impacting success more than others. And maybe we try to start to focus on that. So more on that area too. We mentioned some of these emerging barriers, so we want to continue to build the coalition on this to bring in new partners around it, whether it's economic mobility, domestic violence, and childcare. And then I think as Jody mentioned, our resident leadership council, throughout this pilot process, we didn't have the resources to really do it the way we wanted to if we had that $20 million plan award. So what we've done, we've actually put together a proposal to the state to really provide the resources to the Resident Leadership Council in a way that's going to actually get them into the design phase of some of these new challenges that are coming up. So how do we make sure that we can do this in a way that's going to really meet the needs of residents and start to take away some of these confusing navigation barriers and get them get them part of this whole solution too. And then finally, the last big thing too is, we continue to try to build out other partnerships with employers, whether they're healthcare, manufacturing, or others. So the healthcare we started with because we have a number of different healthcare jobs open here. There's also a number of healthcare trainings already in existence here. But there's also this real desire too to how do we continue to build out other opportunities for residents here. So we're interested in exploring different alignment, learning, and partnerships with other organizations such as all of you. And as we continue to try to knit together this whole system. So these are just some areas that we've started to identify that we think could be useful to start to think about where we could plug in together. Now, for those of you that are involved in philanthropy, of course, the obvious one is funding. That's obvious. And I think our biggest barrier to scalability right now is just the cost of hiring additional navigators and case managers. A lot of the programming is already there, a lot of the programs. It's just hiring these navigator and case managers. But I think too, philanthropy partners bring this whole other element of innovation and other partnerships that they could introduce us to so that we can also build out and grow. So that's an area for them. On the public sector, the delivery of services that residents need to be successful are provided under a variety of state programs that are very specific, that have very specific rules and requirements. And as we've seen, they tend to be siloed and they don't create this continuum of success or continuum of access so that residents can succeed. So we'd be really excited to explore with state partners and municipal partners, how could we partner to better align these systems so that we can actually address these on the ground realities and really help residents reach their goal? And then I think on the employer side of things too, we're always looking for more employers. We know employers need stable employees, and we have evidence on how to do that. So we're looking for more ways to do that to help develop workforce pipelines and hiring and retention partnerships. So those are just some of the ways, and I think I'll turn it over um, back to Jessica. But the last thing is, I will drop my email in the chat for those of you that don't have it. We'd love to be in touch if you have ideas. And finally, we're going to be starting in the next month or so quarterly briefing meetings as a way to continue to build partnerships around systems change. And if you're interested in being part of that, please let us know and I can get you on that. Over
Thanks,
to you, Jess.
Larry.
Thank you.
Thanks, Larry, and thanks again to the Springfield Holyoke team for sharing your work, Jody, Joanne. And we're about to get to Q&A, but I'll just say a few more words while you think of your questions. And Karitza, sorry about that. And while I say a few words, I just wanted to ask everyone, could you put in the chat your name, your organization, and your role? I just think it's always nice to know who you're in a room with. A couple of words, just one thing that really stands out about this effort is that you all did so much with your planning grant. Most of the coalitions we worked with actually spent that time and money putting together a strategy, but y'all already had a really good community informed plan, so you got a jump start. You did a pilot program instead, and you enrolled employers and workers and gathered the evidence and hired caseworkers. It's just really amazing what you did in 8 months. And those early signals are also really exciting. I just want to reiterate for folks on the line that 93% participation rate when the typical number is 40 or 60%. That's strong training completion and job placement rates. Those 5 employees that moved from homelessness into stable housing, and now someone's looking to purchase a home, all while those employers are seeing improved retention. So all this just points to this effort really filling those cracks that people used to fall through so they can become stable, reach their goals, get a solid foothold on that economic ladder so they can actually climb it. And more, we're seeing communities across the country move in this direction, breaking down those silos, building systems out of these disconnected programs. And y'all are just, I think, on the leading edge of this by having created your own model for how that can work here. And it's just such an exciting opportunity to have this pilot program that can be learned from, that can be continued and built upon, and hopefully with the partnership of some of y'all on the line. So thanks again. I'm going to pass to Marissa to facilitate our question and answers.
Great, thank you. And again, huge congratulations and thank you to the Springfield Holyoke Coalition today. Trisha, I see that you have a question right off the bat. I'd love to allow you to unmute and ask your question.
Thank you so much. And I actually have a comment. I hope that's okay.
Absolutely.
I wanted to reiterate how unbelievable these retention results are. And for context, in my previous job, I did large seasonal staffing projects where we would have 500 people working on a seasonal basis in entry-level roles. And our attrition rate, despite many, many efforts to retain and support people, was 200% annually. And so I bring that context to my perspective and and my enthusiasm for this work, I think our region has a tremendous opportunity, and so appreciate this webinar and the work of the team and the funders who helped us with the bridge year. So thank you, and I think let's go get it. Like we can scale this and really create more significant impact. Thank you.
Thank you, Trisha. All right. Everyone, you're welcome to raise your hand in Zoom or just come off mute and ask your question. Otherwise, I am monitoring the chat. I know it's pretty busy right now with everybody introducing themselves, which is awesome. We did have a few questions submitted during the presentation. One asks about the difference in cohort sizes across the pilots. Specifically, why was the employer cohort larger than the family prosperity cohort? Was that driven by a certain factor, capacity, referral flow, et cetera, or something else?
Yeah, great question. I think we decided that basically we knew we could probably work with 40 individuals, and we had these three different areas to really test, whether it was the employer pilot, whether it was the training, or whether it was just getting people in from the community. And so we had three employers, and we thought if we did, if we started to set it up as 555, five incumbent workers, at-risk workers from each would be the starting point. So that's where we made that decision, really.
Great. Thank you, Larry. Another relates to sustainability and operations. The question is, for the wraparound and navigation supports you described, are those services currently funded independently by each participating organization, or is there shared operational funding or another incentive structure supporting participation in the system?
Jody, do you want to take that one?
Sure. Well, I think during the pilot, Recompete was funding that work. But since the pilot had ended and we have been seeking funding, we at Wayfinders have additional employment support programs. So Caritza has been able to serve some of these pilot participants with some of our other funding. And we also have some unfunded participants who we are working with that there is no funding, but we're continuing the work.
Yeah, and I think just to add in on that, we did have a small flex fund
Yep.
to address different challenges that people might have that didn't fall within any of these different programmatic areas. And I can't remember how much that was, Jody, but I remember it was fairly minimal.
Yeah, not enough. Especially that, there are resources out there. You saw that housing instability was one of the big areas. And, housing and keeping people stable or getting them costs to move in can add up. So, I think we only had like $5,000 in flex funds as part of our recompete. But those are the things that help people get to work. Those are the things that keep people employed. Those are the things that really help people solve some of those things that are keeping them unemployed. And so, at any time that we can find some funding to be able to support those needs, and keep them going, right, and keep them moving up that ladder, that's an important part of this work.
Thank you, Jody. I do see in the chat, one audience member is asking about the staffing model behind the pilot. Could you share a little about how many navigators, case managers, or support staff were needed across the three cohorts, and what you've learned so far about the level of staffing required to scale this model effectively?
Yeah, I can take a start, and you can
Okay.
bat cleanup then, Jody. So yeah, we had one navigator case manager, Caritza, and she did a fabulous job. And we budgeted that really around if we had 40 participants, what could one full-time person do? And I think we've learned some things about, maybe some ways to make it easier, maybe some ways to, make that a little bit less difficult. But that was really the model. And I think, when as we think about this growing, some of those participants that are in it now, once they become a little bit more secure, they're going to have less challenges. So that would free up time. But that's essentially the model that we came up with. So Jody, you can
Yeah,
fill
and
in
I
all my
think
gaps.
I think we thought 40 was a great number. And I think it depends. I think it ebbs and flows based upon the participant, based upon their barriers. 40 probably was a little too high for some of the things that the participants were experiencing and the amount of time that it took. Kritz is not just doing case management, she's doing retention work too. And so that kind of level of work for 40 people is pretty intense. So for the sake of your the staff person would look at maybe 40 is a little too high. So
Great. Thank you, Jody. All right. I see we have 1 minute left. So I just wanted to end with a final question here that kind of wraps us up. So, team, you shared several areas where the coalition is beginning to see real traction. As you think about the next phase of this work, where could additional partners help accelerate progress most meaningfully?
Well, I think in the interest of time, if we are starting these quarterly meetings, which I think will be great for other partners that are interested and that have some role to play, whether it's around economic mobility and financial stability, whether it's around training and supports, whether it's around employment. I think there's a lot of opportunities here where people can come in and we can start to have some of those discussions about it. Jody, I don't know if you have other things to add into.
no, I would agree with you.
Great. Well, like I said at the top of the session, I am a firm believer in starting on time and ending on time. So, in the interest of everyone's busy schedules, I would like to thank again the Springfield Holyoke Coalition, as well as all of you that joined us today. This was a very inspiring and fantastic conversation. And we invite you to reach out to Larry via email. I've put his email in the chat a couple times here, ldixon02@gmail.com. And we look forward to being in touch. Thanks, everyone.